Hello friends, this is Dr. Rajiv Dhawan, your ENT faculty, and I have got Dr. Khaleel with me, our radiology faculty. So we are here to present a very interesting question to integrate the CSOM with the radiological findings. And let me read the question for you. A 23-year-old male has history of foul-smelling, blood-stained ear discharge for last 5 years. May I take a second to comment, whenever you get a question like this, that you got a blood-stained, foul-smelling, chronic ear discharge, the first possibility is unsafe chronic suppurative otitis media. Now, the patient has now developed headache. May I take another opportunity? Whenever unsafe CSOM question mentions the word headache, think of intracranial complications. Now, this chap has also developed fever and is pitting edema on the mastoid. Which of the following is not applicable to the probable clinical diagnosis in this patient? First choice, urgent CT would be needed. The CSF pressure would rise on pressing the internal jugular vein. Urgent modified radical mastectomy should be done. And the Grissinger sign is positive. First of all, I'll request Dr. Khaleel to present to us the concept around the venous thrombosis and the radiological findings of that.
So basically, the dural venous sinus thrombosis, right, it can, as sir mentioned, can be a complication of unsafe CSOM, mastoiditis. It can also be seen associated with hypercoagulable states like protein C and protein S deficiency, nephrotic syndrome, pregnancy. So all of these conditions can also predispose to your dural venous sinus thrombosis along with your ENT diseases like CSOM or mastoiditis. And sir, what are the important clinical features do you think associated with dural venous sinus thrombosis?
Whenever we are tackling a case of unsafe CSM with this kind of scenario, the first possibility in our mind is sigmoid sinus thrombosis or lateral sinus thrombosis. The reason is the sigmoid sinus is right behind the mastoid. So this is a case of otitis media with unsafe picture in the mind. So this has caused the thrombotic changes in the sigmoid sinus. So as we all know, the sigmoid sinus is the principal venous drainage of the brain. So we do expect the rise in CSF pressure, and that's the cause of headache in this patient. Now this thrombus is having septic center. So it's going to release septic emboli at after every few hours. So that's why the patient gets spiky fever with rigors, and guys, that is classically called picket fence fever. Now, we do expect that there will be some pitting edema on the mastoid area. The reason is this thrombotic change is going to extend into the mastoid emissary veins also. Okay, so the key things to keep in mind is headache and then fever and the pitting edema on the mastoid in this patient, as this question also beautifully explains.
And most of these other dural venous sinus thrombosis will be associated with headache, focal neurological deficit, seizures, and as mentioned, all the findings that are associated with sigmoid sinus thrombosis. Let us try to understand how the imaging helps us in narrowing down the diagnosis and what are the different radiological signs we see in cases of dural venous sinus thrombosis. So when you are looking at a dural venous sinus thrombosis on a non-contrast CT, what are the findings on a non-contrast CT? On a non-contrast CT, because these are your venous infarctions, and venous infarcts are hemorrhagic infarcts. So on a non-contrast CT, in these patients, we see hemorrhagic infarctions, right? As venous infarcts are hemorrhagic infarcts. You will see a thrombosed vein which appears more denser. There is a hyperdense venous sinus. There is a hyperdense venous sinus, and this hyperdense venous sinus has been given the sign, the delta sign. The delta sign is a finding that you see on a non-contrast CT. Sometimes the entire sinus, like the transverse sinus, may appear hyperdense, and these would be called as Cod sign on a non-contrast CT. So basically, delta sign, Cod sign, they all talk about a hyperdense venous sinus there, and these are seen on a non-contrast CT, suggestive of a thrombus, underlying thrombus. Remember, your CT Hounsfield units or the densities are based upon the density of the underlying area. So whenever there is a thrombus or a clot, the hemoglobin clot that is there, they will become more denser. And as it becomes more denser, it gives you this delta or a Cod sign, a hyperdense venous sinus thrombosis there. And what do you see on a contrast enhanced CT scan? When you do a contrast CT, you will see that the contrast will go towards the periphery of this venous thrombosis, and the thrombus will appear like a filling defect in the center. So when you're injecting the contrast would go from the periphery of the thrombosed sinus, and the thrombus itself will appear like a filling defect. And this has been called as a empty delta sign. So delta sign on a non-contrast CT an empty delta sign on a contrast enhanced CT scan. We do CT venography, right? When we are doing with the contrast studies, we reformat and look at the dual venous sinus thrombosis, which will show filling defects in the involved sinus thrombosis. Filling defects would be seen in the CT venography. And MRI plays a very important role also to identify these dural venous thrombosis, and per se for most of the vascular imaging of the brain, MRI plays a very important role. And in MRI, when you go for a plain MRI, please remember flowing blood appears as a signal void. A normal flowing blood vessel appears as a dark area, as a flow void, right? So a normal flowing blood appears as a flow void. But if you see a thrombus, there will be lack of flow voids. So there is lack of flow voids in the thrombosis. So normal vessel will appear as a flow void, but an area of thrombosis will appear a lack of flow voids in the area of the involved venous sinus. And when you get an MR venography done, right, we can do it using contrast, or we can do it using time of flight technique. So when MR venography is done, you will see a filling defect noted in the involved sinus. So these are the findings that you see on the imaging part. So once again, on a non-contrast CT, you see hemorrhagic infarctions. Imagine if there is involvement of a superior sagittal sinus, bilaterally, parasagittally, hemorrhagic infarctions would be there. If there is involvement of the temporal or the sigmoid sinus or the transverse sinus, you would have them in the parieto-occipital and the temporal regions based upon the cortical vein that is thrombosed. And contrast enhanced CT scan would show you empty delta sign, where you see the thrombus in the center and contrast going from the periphery. CT venography will show you the filling defects on a contrast study. MRI, normal vessels appear as flow voids, but absence of flow voids suggests there is an underlying thrombosis. And the same thing can be evaluated better by getting MR venography done. Let us see the radiological images now. So if you look at the images here, so this is an axial T2 weighted MRI, and you are seeing in the bilateral parasagittal area, you are seeing these areas of infarction. On the CT scan also, you can see that in the high parietal region, there is hemorrhagic infarctions. There are hyperdense areas suggestive of hemorrhagic infarctions. And this cannot be an arterial infarction. Arterial infarctions are more wedge-shaped, more involving a particular arterial territory, either an ACA infarction, MCA infarction. They would be involving one side and more of a wedge-shaped area. But if we are seeing bilateral, parasagittal, and hemorrhagic infarctions, we are thinking of a superior sagittal sinus thrombosis. So similarly, venous thrombosis, they generally produce such hemorrhagic infarctions. And here you can see that the bone is white, and this is a sagittal section showing the dual venous sinuses. And here you can see that the arrow is pointing to a filling defect. You can see the normal veins, they fill up with contrast, but on CT venography here, you are seeing a filling defect. This is another good image showing the CT venography, where the normal area of the sinus is enhancing well, but the area of the thrombus is non-enhancing on a CT venography. And what type of image is this? This is an axial non-contrast CT, right? So on the bone is white, and you don't see any enhancement in the cortical vessels. So this is a non-contrast CT. And on this non-contrast CT, look at this area here. Compare it with this side. This is your right side, and this is the left side. So if you see on the right side, you can see this dense area along the right transverse sinus. This has been called as your cord sign. Cord sign. So cord sign is suggestive of a underlying thrombus here in the right transverse sinus. Look at this image here. This is also a non-contrast CT. You can see that the bone is white, the cortex of the bone is white, and you don't see any enhancement on the vessels. Instead, what you see that the area of the cortical vein and the area of the superior sagittal sinus is appearing more hyperdense. And this has been called as a delta sign. So delta sign is seen on a non-contrast CT and is usually seen in cases of superior sagittal sinus thrombosis. Superior sagittal sinus thrombosis. And if we have a contrast done, if you do a contrast study, you will see that this is a contrast CT scan axial image where you can see that the bone is white, and you can also see a lot of these cortical vessels which are enhancing. So you know this is a contrast enhanced CT scan. And on this contrast enhanced CT scan, you can see in the area of the superior sagittal sinus, on the posterior aspect of the falx, where the superior sagittal sinus goes and joins the confluence of sinuses. At the posterior area of the falx, you are seeing there is this triangular filling defect. I hope you are able to identify this triangular filling defect, right? Contrast is going from the periphery of that area and there is a filling defect in the center. This has been called as your empty delta sign. So delta sign and empty delta sign, both of them are seen in cases of superior sagittal sinus thrombosis. The delta sign on a non-contrast CT and an empty delta sign on a contrast-enhanced CT scan. This is a axial T2 weighted MRI. You can see here the cortical bone is black, right? This is the subcutaneous fat. Fat is white on MRI and the bone is dark on MRI. And you can see all the sulcal spaces, the CSF fluids, the sulcal spaces, they appear white. So this is a T2 weighted MRI. And on this T2 weighted MRI, you are seeing the area of the right sigmoid sinus appears like a flow void. It appears dark. And this is normal flowing blood. Please remember, normal flowing blood appears as a signal void. Flowing blood appears as a dark area, as a signal void. It appears dark both on T1 and T2 weighted MRI. And that is the reason we need to give contrast to look at the vessels better. So normally the flowing blood appears as a signal void. But look here on the left side, look at the left sigmoid sinus. In the left sigmoid sinus, you don't see a flow void. Instead, there is lack of flow void. You can see a hyperintense area there. This is suggestive of a thrombosis in the left sigmoid sinus. So this is a case of left sigmoid sinus thrombosis. Left sigmoid sinus thrombosis. So that is what we see on MRI, what we call as the lack of the flow voids, right? So this is lack of flow void that is seen on MRI. And if you get a contrast study done, this is an axial T1 weighted contrast study. You can see that the contrast is going from the periphery of the vessel, right? And the thrombus is seen lying in the center. So this is seen on an axial contrast studies. If you do a MR venography, when we get a reconstruction done and do a MR venography, either by giving gadolinium contrast or by using time of flight technique, here you can see in the left transverse sinus, you're seeing the filling defect. This is your superior sagittal sinus. This is your transverse sinus on the right side, the sigmoid sinus and the jugular vein. And here on the left side, you can see a left transverse sinus, which is not seen clearly. This is left transverse sinus thrombosis. So this is how we can easily identify the transverse sinus thrombosis or your dural venous sinus thrombosis by using your radiological imaging. So the important take-home points: CT scan shows delta sign on a non-contrast CT, empty delta sign on a CECT. MRI shows lack of flow void. The normal flow voids are absent. Instead, you see hyperintense area on a normal T2 weighted MRI. And you can see filling defects in the MR venography images. So, like going back to the question, like we had increased intracranial pressure also in one of the symptoms there and one of the options there. Would you please explain like how this all correlates clinically?
Yeah, thank you, sir, very much for this detailed information about not just sigmoid sinus thrombosis, but overall about the thrombotic changes in the dural venous sinuses. So, a learning for us also in ENT, that in ENT we classically say the delta sign or the empty delta sign in context to the sigmoid sinus thrombosis. However, from the proper reference of the literature, if you get a question, then please look for the other option, which is a better option, is the superior sagittal sinus thrombosis. So what I'm trying to say there, yes, we do understand that a lot of undergrad books do this, they say the delta sign in context to the disease, but you know what, the reference has to be appreciated over there. So sagittal sinus thrombosis is the best answer in case the delta sign or empty delta sign is asked over there. So let us come back to the question. Now, the question says that is there going to be any increase in CSF pressure on pressing internal jugular vein? Let me just briefly touch the anatomy over here. Now let me take you to, first of all, this specimen over here. Where is my ear? Now please see, this is ear. This ear, the neighboring thing to ear is brain. External ear, middle ear, inner ear, then brain. Now which lobe of the brain lies above the ear is the temporal lobe. Now, which sinus lies behind the ear? Or when say ear, I mean mastoid also, is the sigmoid sinus. Now, this is jugular bulb right below the floor of middle ear, and then we know that sigmoid sinus continues downward as internal jugular vein. So this is the venous drainage of the brain. Now, this is normal person. Normal person. Now look at me, if I press my internal jugular vein, I am actually stopping the venous flow of the brain, and after a while, my CSF pressure will start rising. In you and me, CSF pressure will rise once IJV is pressed for a specific duration. Look at the diseased patient. Now, this patient is suffering from sigmoid sinus thrombosis. Now, there is thrombus in this area. Look at this yellow arrow. Don't you think so? The venous flow of the brain is already impeded over there. Now, in this patient, if I press the internal jugular vein, do you think there is going to be any change? No, because the proximal blockage of the flow of the venous drainage of the brain by the thrombus has already raised the CSF pressure. Now, by pressing the internal jugular vein down over here, I'm not causing any new thing over there. So, the right thing to say is, on pressing IJV, the CSF pressure start rising in normal people, but a patient suffering from sigmoid sinus thrombosis, even if you press the IJV, there will be no change in CSF pressure. Now, the next question is that how can we see the CSF pressure has increased or not increased on pressing IJV? There is no CSF meter over here, by the way. So, there can be two techniques of looking at this phenomenon. Either you can do a lumbar puncture and see the pressure before pressing and after pressing. And this technique of looking at this phenomenon is called a Tobbe-Ayer test. But we do have a simpler technique, non-invasive technique. Let us go for retina examination or fundus examination, because we know whenever CSF pressure rises, there is a retina picture change also. There is papilledema, engorgement of the retinal veins. So let us do 2-time fundus examination before pressing IJV and after pressing IJV. And may I inform you, in this patient of sigmoid sinus thrombosis, there will be no change in the picture of the retina on fundus before pressing and after pressing. So if you do it on fundus examination, it is called Crow-Beck test. Crow-Beck test. So lumbar puncture technique is called Tobbe-Ayer test, and the fundus examination is called Crow-Beck test. Now, let me see the question one more time so that we are able to tell you the correct answer for this. Now, once again, please see. Now, first of all, what is the probable clinical diagnosis? I hope you are sure now. In the backdrop of the unsafe CSOM, headache, fever, and the pitting edema on the mastoid definitely points to a diagnosis of sigmoid sinus thrombosis. Now, this pitting edema on mastoid is another standalone multiple choice question. So, pitting edema on the mastoid is called Grissinger sign. Look at the choice D. So, Grissinger sign is actually the pitting edema on the mastoid. My dear friends, do not confuse this with the edema on the mastoid. Edema on the mastoid can be seen in a patient of mastoiditis also. It's a very commonly done mistake in the exam that people look at edema on the mastoid in a backdrop of the CSOM and they label it as mastoiditis. So, my dear friends, a pitting edema on the mastoid is specifically seen in the case of thrombosis over here, and this is called the Grissinger sign. And now let us discuss the other choices. A choice, urgent CT brain will be needed. Yes, as sir beautifully explained, and I am also now today very clear that, okay, you know, on the CT brain you will see the plain CT1, you see the delta sign, sir, yes. And on the CCT you see the empty delta sign, okay. And the second choice says that increase in CSF pressure on pressing internal jugular vein. That is a wrong option over there. So, B is the answer over here. Look at the C1. What is the treatment of choice of a patient of sigmoid sinus thrombosis with unsafe CSOM? The answer is modified radical mastectomy. It has to be urgent one. But after doing MRM, the last step of the surgery is you open the sinus plate, you open the sigmoid sinus, and you clear the thrombus till the fresh bleeding starts. That's also a question. Once again I say, in this patient, you'd go for urgent MRM, plus open the sinus plate, clear the thrombus till fresh bleeding start. So, my dear friends, this question, the answer is B choice. B choice. Thank you very much, Dr. Khaleel sir. And I hope you guys learn from this integration. Keep learning, guys.